Registered nurses, they get paid a good amount, and also the industry is booming. The healthcare industry is a forever in demand and ongoing industry, which means it changes over time continuously because we're always trying to live longer. We're always trying to optimize our life physically and mentally, and there's always going to be a healthcare sector no matter what. Because our main focus, it seems like right now, is longevity. How can we live longer? How can we prevent aging? How can we prevent cellular death and cellular inflammation in all levels? It's forever changing. That's the beauty of it. You're always going to have a job. And even though as technology progresses, they might weed out certain careers, but there's always going to be new careers that are going to be put into the playing field. And that's the wonderful thing of it, that
Yeah.
even though one job might be eliminated, you have another job to follow it in a different way, but still related to healthcare.
The second benefit is nursing is a job that makes a difference, and that goes into job satisfaction. So, what was your original purpose of going into nursing? It was to wanting to care for people, making them feel better, and that's the job satisfaction you're getting directly from that. There's so many. I had such a better experience working days. I had way more job satisfaction because the patients are always awake. And I've always had such good comments. When we walked out of work, sometimes I was always just like smiling, reminiscing about a specific patient, or, somebody gives me like this little metal pin to keep for, safety because I took care of their grandparents. One guy that's like 90 something is like, man, I love the way you kind of carry yourself. Like, here's a business card. This guy's 93, wants me to check up on him and follow up with him. There's just such a wide variety of people that you meet that always makes things, it gives you job satisfaction. Even if it's a shitty shift, you'll find, if you're optimist, and that's the way I view life, you'll always find something good out of your shift. And the third one is another reason to become a nurse is activity and the excitement at work. So when it comes to activity, this is not going to be a desk job, of course. You're moving around constantly. You're, doing 10, 15K steps a day. Your soles are hurting. You feel tired and exhausted. You're holding your bladder. And yes, there's like the, crazy spectrum of wild, and maybe there's just those slow nights. But when you're a nurse, you always have different patients, different situations. There's always different interactions, and I think that's what makes the job very lively. It's a very double-edged sword where you're driving to work and you have that almost a sense of anxiety. You're like, I wonder how my shift's going to be. But at the same time, that's exciting because you just don't know. You're always living on this edge as a nurse. And I think that's what kind of keeps me outside of my comfort zone is just nursing. It's always just pushing me to learn and do more, embracing my own personal struggles and just giving my best foot forth as a nurse.
Yeah. Yeah. The fourth benefit of being a nurse is flexible schedule and a wide variety of units and specialties. When you go into nursing, you have an idea of how it is, how the system works, what it means to be a nurse. But then once you graduate, you're exposed to this abundance of different places to work and different specialties. You could do pediatrics, you could do babies, NICU, adults, teenagers. You could work in a clinic, you could work in a doctor's office, you could be a flight nurse. There's a wide variety of different specialties, and you're always going to be able to find your niche and something that you enjoy in the nursing field. And what's beautiful about it too is the flexibility of the schedule. If you're a 9 to 5 kind of person, you could be a nurse. You could work a clinic, you could work an ER job or any kind of place that functions on those hours, or you could do the standard shift, which is usually 12 hours in a hospital or a more acute setting, and work 3 days a week. And that's beautiful because you work 3 days a week or 3 nights a week, and then you have literally the rest off. You have the means and the ability to work part-time, full-time, on call as needed, and a lot of times you're able to create your own schedule. So you could bundle your days in 3 in a rows, just so you have ample time to spend with family, or you could do a random vacation. It's very flexible in not only a time frame and scheduling, but also in the different types of works that you could do. The fifth benefit of becoming a nurse is there's lots of room for leadership and ample opportunity for a growing environment. So usually, majority of nurses, they want you to get a bachelor's nowadays. A lot of times, the associate doesn't cut it, especially if you're going for like the magnet status or just a higher rating in the hospital. A lot of people require bachelors, and that's kind of like the new standard, you could say. But after your bachelor's, you get your master's, and that opens the door to many different avenues of opportunity. You could do like leadership, you could do like a clinical nurse specialist, you could become a nursing supervisor, a nurse manager, nurse anesthetist. If you like the acute setting or more the family environment, you could become a nurse practitioner, step into more of a physician's and doctor's role. There's just not only so much things you could do with a bachelor's, but there's also this giant amount of growth opportunity. If you want to watch or listen to our latest episode,
You can check us out on Apple, Spotify, or watch us on YouTube.